How many IVF cycles should I do, doctor? This is a common question which patients ask because patients know that the success rate of an IVF cycle is not 100% and they may need to repeat the cycle before they get pregnant. It's actually a very important question because it shows that you're mentally and emotionally prepared for the fact that this is a journey which may take time, and you have to be willing to commit the time, the energy, the resources, as well as the money to be able to make sure that your journey becomes successful. And the reason for this is that even though an individual IVF cycle has a success rate of about 30 to 40%, depending on the quality of your embryo, your uterus lining, and the clinic you go to, the cumulative conception rate, which means the first cycle, then the second, then the third, and the fourth, keeps on increasing, which means the cumulative conception rate for patients with a good prognosis in a good IVF clinic in about 3 to 4 cycles is usually about 80 to 90%, which means the odds are stacked in your favor that you are going to get pregnant if you have the emotional stamina to be able to do this. However, it's also important to realize that you need to learn from each IVF cycle. There is no single one rule which applies to everyone, and each IVF cycle tells us what went right, what didn't go right, what do we need to change for the next IVF cycle, so that if you get top quality embryos with a good endometrium and a smooth transfer, the reality is you don't need to change anything. You need to keep on repeating it until it works. And often repeat cycles are much easier these days because we can freeze your embryos. And the success rate with thawed embryos after vitrification is as good as with fresh embryos. So you can do multiple cycles without having to take injections every time, without having to do the super ovulation. So it's much easier, much more affordable, and there's much fewer trips involved to the clinic. The important thing to remember is that you need to be prepared for all this before you start your IVF treatment, not after you failed your cycle, because then you're so depressed that you can't think straight and you feel, oh God, my first cycle failed, I'm never going to get pregnant. And the reality is all you require is a little bit of patience. You don't always need to change your doctor just because the first IVF cycle has failed, but you do need to make sure whether the doctor did a good job, whether he provided you with top quality medical care. And this is something I can help you with for free. Please go to our website. It's www.drmalpani.com. I'm Dr. Malpani. I offer a free second opinion on the website. Send me your medical records. I'm happy to review them for you and then tell you whether you're on the right path, whether your doctor did a good job by transferring a top quality blastocyst, or perhaps he didn't do a good job and he needs to make some changes to improve your chances in your next IVF cycle. We look forward to helping you to have a baby.